This is Dr. David W. Kim. Today's video blog is about rhinoplasty, and in particular, what makes an attractive nose attractive. A lot of patients come into my office wanting to look better, and they can't really put their finger on exactly what they don't like about their nose, and they don't really know exactly what makes an attractive nose. I think a lot of people understand what they don't like about their nose, but they're not quite sure what is going to look best. Now, every nose is different, and every attractive nose doesn't have to look like another attractive nose. However, there are certain shared features. One is that the nose should have fairly smooth contours, and second, the nose should have an overall triangular shape. This means the front of the nose should be relatively narrower, and the base or bottom of the nose should be relatively wider, and there needs to be a smooth or straight transition between the front and the base. This can be seen in this angle, where the base view of the nose shows this very soft triangle. Not a triangle coming to a point, but a triangle coming to a soft, relatively narrow front. When the nose doesn't have this orientation, one of my favorite techniques to create it is called a lateral crural strut graft. This is a rectangular piece of cartilage that's stiff and straight and can be placed under the existing tip cartilages to convert the nose into a triangular shape from its original starting point. One example is a patient like this. The tip cartilages are flared outward. They're very stiff and strong, creating this very boxy, bulbous appearance. These lateral crural strut grafts are placed on the undersurface of these flared cartilage and sewn to them so that the cartilages can become straighter and flatter, creating an overall triangular profile. When you see this patient from the front view, this translates into a nose with a narrower tip and then has more favorable natural shadowing on the sides of the nose, creating a more refined appearance. Another type of nose in which this is helpful is the nose with collapsed sidewalls. This is the opposite problem. This is when the tip cartilages are caved in or concave, creating this pinching. This can create problems breathing, and from a cosmetic perspective, this can create unfavorable shadowing on the sides of the tip, making the tip look isolated. In this case, I use lateral crural strut grafts to reinforce and strengthen these native cartilages so that the nose can take on, again, a more triangular appearance. You see before, the tip is isolated. There's harsh shadows that separate the tip from the base of the nose. And after these grafts are placed, the tip transitions more smoothly into the base of the nose, creating this refined triangular appearance. The lateral crural strut graft is a very powerful technique in rhinoplasty that can alter the shape of the nose into a very pleasant, soft, triangular form. This allows for better shadowing of the nose, more refinement of the tip. It can improve breathing. It's a safe and reliable technique that's helped many of my patients.